My name is Dr. Richard Weil. I'm a paediatric oncologist at the Mayo Clinic in Rochester, Minnesota. I'm extremely proud to be a 2018 Hyundai Quantum Award winner. So I trained at the University of Oxford, where I got a degree in biochemistry, and then I did further medical training at the University of London. I did a couple of postdocs in London at the Imperial Cancer Research Fund laboratories, and then I came over here to Mayo, where I'm a professor of immunology, professor of paediatric oncology. Most of my time is spent in the lab. In my mind, there are two sort of levels of research. There's the sort of the blue sky research, which is knowledge for knowledge's sake, and I think that's incredibly valuable because by definition you don't know what that's going to turn up, and that can lead into all sorts of things. Our particular interest is much more in the clinically translatable type of research, where we take existing treatments, we take the disease, we try and understand what's going on. At Mayo, certainly, we're very interested in taking that into the clinic so that what we actually spend the dollars on will actually translate into patient care. We're particularly interested in a disease called diffuse intrinsic pontine glioma, which is a pediatric brain tumor of the brainstem. It's universally fatal. And because the tumour grows in the brainstem of the patients, it's a very difficult disease to treat. So within the spectrum of all paediatric brain tumours, DIPG is our sort of specific interest. So the intent of our research is to try and see if we can use the immune system of the patient with the cancer to start to attack that cancer. We have evidence, and a lot of people have evidence now, that if we re-educate the immune system in those patients, we can direct immune cells to the cancer, and those immune cells can effectively destroy the cancer, which takes away a lot of the toxicity associated with the current treatments, which are chemotherapy or radiotherapy. And although those treatments are getting better and more specific, if we can get an immune-based mechanism for clearing cancer, that would be a huge step forward in terms of eradicating the disease and doing it in a more gentle way than is currently possible. So we were fortunate enough to receive the Hyundai Quantum Award for $1 million. That to us is a huge amount of money because it allows us to take what we've discovered in the lab into the clinic. Our goal is to use that money to develop the reagents to initiate a clinical trial in pediatric brain tumours. And that's a unique sort of use of this funding because it's very difficult to get that sort of funding in any other context. With this award, the money is there, we can use it immediately, and we can move 10 times quicker than we would if we had to go through other traditional sources of funding. Our initial goal is to be able to generate an immune-based therapy which will extend survival of patients with DIPG or other pediatric brain tumours, but not just extend survival, but extend survival with quality. And this award will help us, we think, take those first steps and hopefully keep us moving, into the future. I've seen thousands of pediatric patients with brain tumours, and that again comes back to this concept of is 80% the ceiling of our achievement, and it's absolutely not. Until you have seen patients, who are destined to die, then, until it's 100% reproducibly, then I think, the field needs to keep moving, and awards like this are what will keep the field moving and pushing on to the situation where, at some point in the future, I think either we will have 100% cure or we'll have significant benefits over what is possible now. So I would say to parents who have a child who's newly diagnosed with brain tumour, it's clearly hugely frightening. It's the worst news you can have. And I'm not pretending that everything will work out fine. But what I would say is that my experience is that through those hugely challenging journeys, there is a lot of hope to be gained. You're not alone. The concept that there is real hope is very real. I don't think that I would be doing what I do if I did not believe that this will all lead to improvements in treatment. If you can develop treatments which improve quality of life, extend survival, and eventually lead to cures, that I think has to be a cause for great hope, a cause for great satisfaction in what we do. Every day we learn something With every patient that is treated, either with established therapy or with an experimental therapy, we learn something new. The patient benefits from that, and other people will benefit from that tremendously. September is Childhood Cancer Awareness Month. Give a hand.